Welcome back, everyone, and thank you for joining this talk on non-traditional jobs for nursing students. We encourage you to send in any of your questions in the Q&A tab along the right-hand side of your screen, which will be addressed toward the end of the session if time permits. Without further ado, I would now like to hand it over to Morgan Lima, registered nurse and founder of the Teachable Nurse podcast. Please send her a warm welcome in the chat.
Hello, thank you so much. Can you see my screen okay? All right. So yes, thank you so much. Hi, my name is Morgan Lima. I am a registered nurse and writer and nursing instructor. I also run a blog called The Teachable Nurse, which aims to help nursing students like yourselves. Today I'm going to be talking about non-traditional jobs for nursing students that you can do while in nursing school without the requirement of a license. So just a little bit about me. I graduated from nursing school with my BSN in 2016. I've worked inpatient and outpatient, and currently I work as a research nurse, specifically in the field of infectious diseases. In 2021, I earned my Master's of Science in Nursing Education, and I am an adjunct nursing instructor at a local university. Teaching as an adjunct, I realized how much I love coaching nursing students through the hurdles of school and communicating with instructors, making the most of your time at clinicals, and just knowing how you learn best are some of the things I love helping students with. I wanted to create a free online platform that catered to those specifically, hence the Teachable Nurse blog was born. Since then, it has grown into a podcast, an online store with digital resources like downloadable note-taking templates, and free videos to give you a little extra help mastering the most difficult nursing concepts. One of the things I touch on in my blog, but I'm going to expand upon today, are jobs that you can do while in nursing school or when preparing to apply to nursing school that will allow you to use those critical thinking skills, but do not require a license. So with that, let's get started. Here are the objectives for this presentation. By the end of the presentation, I hope you walk away with the ability to identify non-traditional jobs within the scope of the student nurse, identify keywords and search terms to search when looking for these jobs, and know how to incorporate skills learned in these positions into your resume. So first, let's talk about what some of the more traditional jobs we think of for nursing students. One of these may be referred to as a nurse externship. Nurse externships are formal programs through hospitals that recruit nursing students who have completed a certain level of nursing education. These programs usually take place in the summers with shorter time commitments during the school year. These allow nursing students to practice their technical skills while learning from seasoned nurses and gaining real-life experience. It's basically like going to clinical every day, but getting more and more experience. Another typical job that nursing students can do that is hospital-based is as a nurse's assistant. And these job titles are also referred to as care partners, care techs, nursing techs, or nurses' aides. And these positions do not require a nursing degree or a license, but they do require you to be able to perform the most fundamental nursing skills without supervision. So these would include things like taking vital signs, catheterization, bed baths, and mobility assistance. Both of these are fantastic options if available and feasible for your schedule. But not everyone has these opportunities, and therefore the question becomes, how can I maintain and even grow my nursing skills during the seasons when I'm not in school? We're going to discuss where to look for these jobs, what keywords to use, and how to use these experiences to your advantage when applying to your first nursing job. All right, so the first job we're going to take a look at is that of a camp counselor. Now, at first glance, it may not seem like rallying a bunch of kiddos in the summer heat for 8 weeks carries much potential to carry over to a nursing resume. But certain camps require counselors with specific skills that you, as a nursing student, just happen to have. Certain camps around the country cater to specific needs of kids. Some examples include camps for kids with diabetes, camps for kids with developmental delays, and grief camps for kids who have undergone a traumatic loss. All of these places need counselors or leaders who are educated in the physical and psychosocial aspects of these campers. For example, working at a camp for kids with diabetes means you are constantly checking campers' blood glucose levels, monitoring their dietary intake and activity level, and treating them within your scope of practice. This is a huge responsibility, much more than a typical camp counselor position. There are camps like this across the country, catering to a multitude of conditions. If you don't know of one near you, you can look up the nearest one online. So let's continue using a diabetes camp for our example. If you go to the American Diabetes Association website, they have a section for their ADA camps. There is a place for you to fill out your contact information and get more info. There's even a button that says Find a Camp Near You, where they list their locations by state. Another national camp for kids is the National Kidney Foundation's Camp for Kids with Kidney Disease. Many of these kids are on dialysis, and while you won't be the one performing certain nursing skills, you will learn a lot by observing and being involved. So to summarize, you can search foundation websites for the specific type of medical condition you're interested in, see if they have a national network for children's camps, and then search keywords like camp counselor, camp volunteer, or camp medic. Parenting magazines, either print or online, are also excellent resources for finding these. Even if you're not sure if you have enough experience or knowledge quite yet to apply to some of these positions, remember, most of the camps are required to provide training and education prior to the start of their session. Many counselors probably won't have any healthcare background, and therefore you'll have a leg up. Something to consider if you are interested in working at one of these camps is that a lot of these positions are volunteer-based. So while the experience you get will be priceless, you may not make a paycheck for a couple of months. However, if you are a nursing student whose end goal is to work with patients with a certain condition, such as a certain cancer, it may benefit you to volunteer at a camp for oncology patients. The sooner you immerse yourself in your medical specialty of interest, the sooner you'll be able to know if this is the path you want to go on, or if it's nothing like you thought it would be. And since these camps usually take place during the summer, these positions are beneficial for those who are in a semester-based program that follows the traditional school year. If the camp schedule sounds appealing, but you're not interested in being a counselor, many camps enlist paid interns or employees with medical skills to work under the camp nurse or doctor. The thing about some of these jobs is that they won't be obviously advertised. So a good place to start is to locate a camp that you would like to work at, identify the contact email of the camp administration or leader, and email them an introductory email with your skill set and ask if there is any need for someone with your skills for their next section. Remember, the answer is always no unless you ask. This is an example of how you can incorporate your experience as a camp counselor on your resume. You will list the things that you did in your role as a leader, and then, specifically, which aspects of the job were relevant to healthcare. For example, working at a camp for kids with diabetes, you could list things like led a cabin of 12 girls diagnosed with diabetes, performed glucose checks, and campers, titrated doses of insulin based on specific protocols, counted carbohydrate content for each meal, triaged girls who felt ill while at camp. You want to include everything that's related to healthcare and leave out anything that's not. Shifting gears, the next opportunity I want to discuss is finding an internship at a healthcare nonprofit. I'm going to speak to my personal experience with this. After my sophomore year of nursing school, I had fundamentals and basic clinical skills under my belt. I had completed clinical rotations in nursing homes and a med-surg unit. I was skilled in taking vital signs, finger pricks for blood glucose testing, catheterization, and other activities of daily living. I did not have the means to stay in the city where my nursing school was and spend the summer interning at the hospital, which is what a lot of my fellow students did. So I returned to my hometown and found an internship at the Tennessee Kidney Foundation. It was a small office with 4 people, including myself. The job description entailed answering the phone, sending out gas cards to qualifying dialysis patients, and helping with setup and tear down at community events. But by the end of the summer, the position had turned into so much more. I advocated for more opportunities for myself, citing the nursing skills I had under my belt. I ended up not just being sent to community events on my own, but also tasked with taking blood pressure readings on community members who came to my booth. By the end of the summer, I had performed hundreds of manual blood pressure screenings, which may not seem like a big deal, but in the grand scheme of things, I had mastered a clinical skill that otherwise I wouldn't have practiced for 2 months. I screened folks for elevated creatinine levels in their urine, and I also had the opportunity to create educational materials on kidney disease, which is a subject I never had interest in before. But because I was immersed in the field and surrounded by patients and doctors at different events I worked, my interest in the condition grew. I met so many people at those events and over the phone, even just through meetings I attended as a note taker. I met one nurse in particular who I ended up asking if I could shadow her at a dialysis clinic for a day. I was curious about what being a dialysis nurse entailed, and this was not an opportunity offered through my school's nursing program. She was gracious enough to let me shadow her, and I learned so much about this specialty of medicine that I otherwise would have overlooked. The assessments and skills the nurses were doing were so beyond what I had learned so far in school, but I tucked all of it away and brought it back when we tackled kidney disease in our junior year. I ended up curating the internship in a way that both the nonprofit benefited from the skills I offered, and also I benefited from the professional relationships I made throughout the summer. My supervisor ended up writing me a letter of recommendation to my very first nursing job out of school. While I ended up not going into the field of kidney disease or dialysis nursing, the content I learned, especially related to fistulas in patients with kidney disease, translated to my work on a medical surgical unit and gave me the confidence I needed to care for these patients. This is just one example of a healthcare nonprofit you can find an internship at. Some may be a lot larger, some may even be smaller than mine was. I heard about this internship through word of mouth. Because I knew the nonprofit existed close to my house, I decided to pursue a job opportunity with them. If you're interested in looking for a similar position but don't know where to start, begin by searching for healthcare organizations that you are interested in. It may be oncology focused or psychology focused. There are plenty of nonprofits that cater to mental health needs in their community. Google healthcare nonprofits or healthcare charities plus your city's name. You can also look for a list of foundations associated with your area of interest with a simple web-based search. Job boards may have positions like this, but more than likely they will be advertised on the organization's website or social media. A lot of times these organizations will make like a Facebook post or an Instagram post if they're looking for a summer intern. Whatever your focus is, here are some questions you'll want to ask. Is this a paid internship or position? What are the roles and responsibilities? Are there opportunities for me to bring in my technical nursing skills to the job? Is there any travel involved, and do I need to provide my own transportation if so? I ended up doing quite a few community events across the state of Tennessee, and to do that, I required my own car. So I'm glad that I asked that at the beginning of the summer so that I could make that arrangement. It's important to find out what the time commitment would be and if that would get in the way of your schooling, so be sure to ask if this is a seasonal position. Get a sense of whether this would be an office job or if you would, like me, have the opportunity to use your skills at health fairs and community health screenings. The great thing about this summer internship is that it was a year-long position, but I only could work during the months I was home from school. If you're able to find an internship that is year-round, then you could continue to work and make money during the school year. The next type of job you could consider may be considered more traditional than others. This position is as an ambulatory clinic assistant. Working as a medical assistant or clinic secretary at an ambulatory clinic is a great way to shadow multiple disciplines and network within a healthcare system. This is also a great position for someone who hasn't mastered the fundamentals of nursing yet, but still wants to get their foot in the door in a healthcare environment. There is an abundance of specialty clinics, and even if you're not performing typical nursing tasks, it can give you a unique opportunity to develop professional connections within the field you're pursuing. Some examples include fertility, pediatric, outpatient surgery, dermatology, and OB/GYN clinics. Some clinics require anyone taking vital signs to have a certification as either a medical assistant or clinical nurse assistant. These certifications are obtainable as a nursing student. You may want to ask your nursing professor about local accredited organizations that offer these. However, you may not need to get these certifications and still be able to get some practice with your clinical skills as long as it's under the supervision of clinic nurses. I know that the American Red Cross offers classes for those who are wanting to get their CNA certification. Maybe there's a clinic you can think of that you would like to look into. If not, don't worry. One way to begin your search is to start with the hospital system that you currently do your clinicals at or that is near your home. You can look up what clinics are located within that hospital system and see if one piques your interest. You can also go directly to the website for the clinic you're interested in, find the contact info for the clinic leader, and send them an email of inquiry. Even if there's no openings at that clinic, they may know of another one that could use your efforts. Finally, a job board for the hospital system may have non-clinical openings you can look into. Be sure to use that filter that says non-clinical or non-licensed when you're searching. There's a lot that you can get out of your experience working in an ambulatory clinic. Let's use the example of a fertility clinic. Not only will you learn so much that can translate to your OB clinicals and future job prospects, but you will also have unique opportunities that you won't get from other clinics. You'll learn the general basics of how a clinic functions, but be able to practice your nursing skills. But you'll also see procedures specific to fertility treatments. Fertility clinics also function as a type of surgical outpatient facility because some of the procedures conducted within the clinic, like egg retrievals, require that sort of level of care. You'll observe and be exposed to things like sterile procedure, anesthesia management, and specimen collection. Depending on the clinic, you may even be able to practice your phlebotomy skills, especially if you have a certification in phlebotomy. Even working in general primary clinics, you will receive experience in keeping paperwork organized, rooming patients, observing HIPAA compliance, which is super important, and advocate for patients by communicating with their providers, participating in continuing education opportunities, and may be able to practice certain skills like phlebotomy and injections under the direct supervision of a nurse. The opportunities to practice your nursing skills will vary depending on the clinic you're at and what their rules are for nursing students. But wherever you work, you'll have experiences that will translate to real-world nursing, regardless if you work in the ambulatory setting or not. Next, let's discuss caregiving. A job as a personal caregiver can entail many things. Caregiving requires a level of skill and commitment that may not be expected in traditional babysitting. So as a caregiver, you are providing intimate, life-preserving care by assisting with activities of daily living and some health-related care like medication administration. The client population ranges from young children to elderly adults, so this is a great option if there is a specific age group in which you have a vested interest. When looking for this type of position, you can either look as an independent contractor or through an agency/company. I'm going to focus on how to find a position like this as an individual. If looking for yourself, a good jumping off point is local Facebook groups. There are several groups like this on social media who post their job needs, and vice versa. You can advertise yourself and your own schedule to see if it fits anyone's needs. Another good place to start when looking for caregiver positions is care.com. Here you can create a profile and specify exactly what types of jobs you're looking for. If you are interested in working with people with special needs, for example, you can add that to your profile and job search. There are plenty of people out there who need a little extra help managing their medical conditions, and student nurses are great for these roles. Another way to find these positions is to ask your nursing professors if they know of anyone looking for a caregiver. Many times, people in the community will turn to local nursing schools if they are needing help with a loved one. I know that lots of folks in my community reach out to the university I teach at, asking if there's a nursing student with certain skills or certain interests. Be sure to know exactly what skills you're comfortable with and are within your scope before applying to a job. I found out about another position I had during the school year from a young woman with cerebral palsy who gave talks at the school about her condition. She and her sister lived together with cerebral palsy, and each semester they hired a couple of nursing and physical therapy students. I applied and I got to be one of their caregivers for a semester, along with 2 physical therapy students. This was such a great experience because I learned about the important range of movement activities for those with the level of cerebral palsy that these girls lived with. They were both wheelchair users, so I got a lot of experience with transfers and proper mobility techniques. And one of the young women also had diabetes, and as her caregiver, I prepared her meals, checked her blood sugars, and administered insulin as needed. That's one thing you will get a lot of experience with as a caregiver, medication administration. And with pharmacology being such an important and sometimes stressful topic in school, working one-on-one with someone with a wide range of prescriptions helps you understand real-world medication administration and gives you experience you otherwise might not have. I formed a fantastic relationship with a family I worked for several months, with whom I connected through care.com. It was a typical nannying job, except for the fact that the client had a G-tube and needed someone who was comfortable managing feedings. I had not yet learned G-tube care in school and told the family that, but they were more than happy to teach me exactly how they managed this one. Neither of the parents were in healthcare, but they managed their daughter's G-tube. So they taught me how to do it, and I was able to master this skill, doing it every day for 2 months, and bring back what I learned to school the next semester. Many caregiver opportunities involve being a companion for someone who has a physical disability and needs help getting around their home so they can stay out of a facility. This is such an important job and is perfect for a nursing student. As a nursing student, you have the compassion and patience to care one-on-one for these folks. So many agencies who train people for these positions are understaffed. And even if someone qualifies for help through these agencies, they may be waiting months for someone. You providing that bridge in care can be so rewarding, not just to the client, but to their family as well. Additionally, what you get out of the job, you'll be able to take with you to your next set of clinicals and other nursing jobs. Depending on the position, you'll walk away with more experience with bathing, toileting, and feeding, medication preparation, and polypharmacy, taking vital signs and increasing your assessment skills. You may have to call 911 at some point. You may have to call their doctor based on what you assess in the client. Mobility, safety, and body mechanics, communicating with the client and their family, accompanying them to doctor's appointments and gaining education just from listening in if they let you, possible GI management like PEG tubes and J tubes, rehab equipment if the client was in a traumatic accident, and then lines, drains, and wound care. A great thing about working as a caregiver is that you can set your own rate and work for as few or as many families as you like. This level of flexibility allows you to work year-round if needed, changing the hours based on your class and clinical schedule. When applying to these jobs, it's important to highlight specific skills that you've learned in your nursing school journey, not just cite the classes you've taken. So, for example, when applying to a position as a caregiver for a geriatric patient, it's important to highlight your experience with bathing, changing, toileting, medication administration, and proper transfer techniques. Even if you just spent the past semester in OB rotation helping to deliver babies, these aren't necessarily skills you'll need for this particular job. Here's an example of how you would list this position on your resume. List the time you spent there and the skills you performed as they relate to healthcare. For example, provided one-on-one care for 72-year-old client, assisted with activities of daily living, managed clients' medications, performed blood glucose checks via finger prick twice daily, managed clients' feeding tube, performed wound care on sacral wound until healed. So those specific skills that you do with your client are really important to highlight on your resume, not just generalized, like provided companion care, really get into specifics. Another job I don't hear talked about a lot these days is medical scribe. Medical scribes follow a provider from patient to patient, taking notes or writing what the provider says. Providers are constantly in need of medical scribes. You don't have to be licensed to be a scribe. Some higher level medical scribes you do, but just a regular entry level part-time one you don't. You don't have to be licensed, but if you're a newer nursing student who hasn't mastered technical skills yet, getting a job as a medical scribe can get your foot in the door to a hospital or area of medicine that interests you. Medical scribes follow providers while they round to record notes for them, collecting information to record in the Electronic Health Record, or EHR. Not only do you get immersed in the specific medical diction and terminology that you will eventually need to be fluent in as a nurse, but you'll also get to network with interdisciplinary teams. Getting your foot in the door at a hospital system can open an array of doors for you down the road. To find a job as a medical scribe, look on the hospital's job board or ask your nursing professors if they know of any providers needing a medical scribe. If you can make a connection with someone who already works as a scribe, it may be worth asking them if you can shadow them and see what the job entails. Don't forget to look at other health sciences departments for jobs as well. For example, if your school has a physical therapy or a physician assistant program, you may reach out to their faculty to see if they know of any opportunities. And finally, Scribe America is an online database of scribe opportunities, and you can search for them based on location. So you just type in your city, and they present you with if there's any needs for a scribe in your area. It lists the hospital and what the need is. The final job I'll talk about today is that of a student research assistant. This is a very generalized term that can be used to describe any job that involves a student either assisting in bench research or clinical research. For bench research or basic research, you wouldn't be interacting with human participants, but you would be assisting in analysis or data collection. But for clinical research, you would be interacting with human participants. You may be asking them if they want to participate in a research study, explaining that study to them, consenting them to be on the study, and following up with them. These are usually short-term commitments based on how long the principal investigator has funding for, as well as how much funding they have. If you're interested in assisting a professor in their research, don't be afraid to ask around your school to find out what kind of research your professors are doing and if they need a student researcher. You can also look into opportunities on university hospital job boards. Even if you're not affiliated with the same university that hospital is, it may be worth searching for words like student researcher worker, unlicensed research assistant, or student research assistant. For example, I work for a university hospital system as a research nurse, and often we need part-time research assistants who focus on recruiting people for our studies. And this does not require a degree or a license. And we usually hire students to help with this process as grant money allows. I added this last slide in here just to kind of go over some non-traditional jobs for nurses once you leave nursing school and once you have that license. I think there was a question submitted before the presentation about what some non-traditional jobs are for nurses. And this is just a few that I could think of off the top of my head. There are so many others, but I'm just going to go down this list pretty briefly and just kind of tell y'all what each one entails. So starting with research nurse, I became a research nurse 5 years ago, and I love it. I can't imagine doing anything else full time. I love my job. I work basically under doctors who are physician scientists, and I help them basically develop their studies, and I recruit patients, participants to be on the studies, and I conduct all of the procedures that have to do with the study, and then give that data to the physician scientists. Case managers typically work inpatient or outpatient. I actually, if you're interested in case manager roles at all, I did do an interview with a case manager on the Teachable Nurse podcast. She worked both inpatient and outpatient, and she gives a really good insight into what that job entails. Essentially, you are coordinating care for patients. If you're working inpatient, you're coordinating their care upon discharge. If you're outpatient, you're making sure they have all their medications that they need, all the education they need, and have access to resources like transportation to and from their appointments. Nurse educators who work in the hospital are nurses who typically have a master's degree in education. They make sure that all the nurses on their unit are up to date with their certifications. They provide any training on new policies within the hospital, things like that. You can be a clinical instructor. You can apply to different nursing schools around your area and be one of the clinical instructors that meets students at their clinical site and spends that 12-hour clinical shift with them. Nursing informatics, I am not super familiar with. You do need a master's degree, though. They basically work on electronic medical record systems, so EMR or EHRs. Utilization review nurses typically work for insurance companies or the hospital itself as like an auditor to make sure that everything's being billed correctly, that all the billing codes are correct, things like that. A nurse health coach typically works one-on-one with clients and patients. They can either work for themselves. You can have your own, LLC, your own company, or you can work, some insurance companies hire nurse health coaches. Forensic nurses typically work in the emergency room, and they are there for patients who come in with a history of domestic violence or who have been assaulted, and they help collect evidence, be with the patient, and then sometimes they will testify in court. A health screening nurse or biometric nurse for life insurance companies you can literally go to clients at their place of work and get their vital signs and draw their blood. And that's for clients who are applying for life insurance. And it saves them a trip to their doctor. A legal nurse consultant, you do need a special certification for, but essentially you would be asked by a law firm to look over medical records and give your input and be willing to testify in court. Wound care nursing is super important. I have mad respect for wound care nurses. They typically work in the hospital and in like the home healthcare setting. and they specifically just focus on wound care. And a lot of it has to do with sacral wounds in folks who, have those really deep, like stage 3, stage 4 wounds. Home health nurse, also have an episode of this on the podcast. They go from home to home, providing nursing care, such as taking vital signs, drawing labs from a PICC line, providing wound care as well, things like that. A school nurse, pretty self-explanatory, but a lot of what they do is keeping up with children's immunization records, seeing kids, as they feel ill. And the thing about school nursing is it is one of those positions that you have summers off. So I know a school nurse who decided to pick up back in the hospital during those 2 months she has off. So she still gets to do a little bit of inpatient hospital nursing, but most of her time is spent at a school. And then these two are pretty interesting to me: amusement park nurse and cruise ship nurse. One of my professors in nursing school was a cruise ship nurse at one point, and she loved it. It's essentially like it sounds. You're a nurse at an amusement park, kind of like a medic for people who, pass out because of heat or dehydration and need that immediate care. And then you triage them to, if they need to go to the emergency room, you would facilitate that. And then finally, NCLEX nursing instructor. A lot of these positions are individual or independent contractor positions, but you go from university to university based on what that school has a contract with, and you go and you do the NCLEX training if that nursing school has elected for that program. So this concludes my presentation on non-traditional jobs for nursing students. I hope you were able to take something valuable away from what we discussed. I want to say thank you to TrueLearn and Picmonic for inviting me to speak today. And also, thank you all for your time. I know your time is really valuable, and I just really appreciate you taking the time to listen in. And I think we're going to do some questions next.
All right. We did just receive one question. One moment. All right. This is from Nancy. Please, which of these jobs do you recommend for new grads waiting on their license since they have more experience?
Yeah. Yes. Okay. I love this question. So if you have and I may not understand it right, but if not, just, tell me. If you've graduated from nursing school and you're waiting on your license, especially if you say like graduate in May and you're still waiting for your license, I honestly really recommend doing a camp nurse position, because a lot of times you don't have to have your license as a camp nurse. You can, you're working under a doctor or a medic or a paramedic. And that, I know nurses who have spent their summers doing that, and they do not regret it. They got so much experience in that time. They did not feel like they were, not using their technical skills and everything. So that's what I would recommend.
All right. Do you need experience working in healthcare before graduating to get hired?
No. So your clinicals are going to give you what you need to get hired. These jobs or these internships can give you a leg up. They can, especially if you're wanting to go into a field that's very specific, say like if you wanted to go into diabetes education or, dialysis nursing, these sort of things would definitely set you apart from other people who are applying for those positions, but you do not need to work outside of school. School is a full-time job, and institutions recognize that.
All right, thank you. And again, these questions that I'm reading off, these couple are from people who registered for the event and the ones that they submitted with their registration. That's why they're coming from me. All right. Career opportunities apart from clinical setup for international educated nurses.
The career opportunities from clinical setup for. So I'm not super knowledgeable about international nursing. I will say that first and foremost. Career opportunities apart from clinical. So my recommendation for whoever answered or asked this question is to go on the American Nurses Association website, and they have a slew of information for international nurses coming to work in America, if that's what the question is. As far as international nursing working in their respective country, each country has their own like nurses association with a list of everything that they require from their board of nursing, if that makes sense.
Thank you. And I just also added another question up here that is very similar, but what do you recommend for a foreign nurse that just came into the United States? And I believe you just answered some of that, but I didn't know if you wanted to add anything else there.
Yeah, if you are licensed in your home country and you're coming to the United States, again, the American Nurses Association has a step-by-step process of how you become licensed in America. But some of it, just briefly, you have to pass your boards in the country where you were educated as a nurse. You can then take there's a long acronym for it. Essentially, it's a test that asks you about basic, like high school level education, and then also like maternal health nursing, med-surg nursing, pediatric nursing. And once you pass that, then you can sit for the NCLEX. And then after you pass that, you can apply for a work visa. But again, American Nurses Association has a step-by-step of how that works.
Awesome. All right. And this is the last question that we have. Unless anyone else wants to submit questions, feel free to submit them in the chat. But what does a master's degree in nursing look like, and who should get a master's degree in nursing?
Good question. So a master's degree can look like several things. I personally went for a master's degree in nursing education because I knew I did not want to be a nurse practitioner. The difference is that I can't practice clinically. I can't write prescriptions. A nurse practitioner has a master's degree as well as a certain level of clinical experience that they had to do and pass boards and everything like that. So if you want to be a nurse practitioner, if you want to practice medicine and write prescriptions and do all of that, you need a master's degree, and then you need to complete certain level of clinical rotations, sit for an exam, and then you can be a nurse practitioner. If you want to be like a nursing instructor, most positions require you to have a master's degree, typically in nursing education, and that's what I have. Hospital administrators or like nurse managers usually have a master's degree in leadership and management, and that's literally what the degree is, Master's of Science in Nursing and Nurse Leadership. I did an online program. You can do online, in person. It's really completely up to you. You don't need a master's degree necessarily to move up in your field, which I think is the great thing about nursing. There are also certifications you can get that can elevate your career, and you do not have to go back to school to do that. But essentially, who should get a master's degree in nursing? Find out what your goal is, what your end goal is, what job you're wanting, and then just see what the requirements are for that, because you may not need a master's degree for it.
Awesome. Thank you. And then our last question, what types of jobs do you recommend for a nursing student with various types of experience in healthcare?
What types of jobs do you recommend? So for a nursing student with various types of experience in healthcare, I would say if you have various experience already, if there is one specific area that you want to focus on or grow in, I would look into that. Like, say you are interested in working with, pediatric patients. I would look for like home health, pediatric, like nursing assistant positions, which again, you can find through care.com. You can also find through certain home health websites, because typically when people think of home health nursing, they think of like adults or geriatric patients, but they also need home health nursing for pediatric patients, because a lot of peds patients are on trachs and breathing tubes and have PICC lines. And so you can get a lot of experience that way. But if you're not sure what area you're wanting to go into yet, that's okay. And I would just say, honestly, probably either the caregiving or find a job at the hospital system that you would eventually like to work at, and get your foot in the door there.
All right. And do we have time for one more question? It was just submitted in the chat.
I'm good.
All right. This is from Nancy. It is a bit of a long one, and I want to read it all to make sure I'm not missing any of the context. She finished in August and hasn't taken the NCLEX yet. She does have caregiving experience, which she thought wasn't helpful. So thank you for the tips and for answering her previous question. Currently inquiring about a tech job. Do you think it's not necessary to get acquainted on a unit you want to work on as a tech? Just looking into med surg, and then she said she just needs advice with balancing work and studying.
Good question. If you don't need the job right now, like for money or anything, I honestly would say just focus on studying. If you do, if you need to be working, then I think that's a fantastic idea to try to get a job as a tech on the floor that you would like to eventually become a nurse on. It is not mandatory. It is not necessary. I never had a job working inpatient nurse, like as a nursing tech or anything. And I worried that would prohibit me or limit me in my options for getting hired as a nurse eventually, but it didn't. So hope that answers your question. You will get perfectly acquainted once you become a nurse and get hired on that unit. Trust me.
Awesome. Thank you, Morgan. This has been so helpful. And thank you everyone for joining us. Please feel free to send any more questions that you have to webinars@truelearn.com, and we will get back to you with answers. And we hope to see you at the next session starting at 1 p.m. Eastern Time with Kevin Gibson discussing Next Gen NCLEX. Thanks, everyone.
Thank you.